What kinds of Medicaid are available for adults with disabilities, for families and individuals? Presented by Granite State Independent Living's Financial Planning and Benefit Services. What is Medicaid? Medicaid is a federally subsidized health insurance program available to low-income individuals and families who need assistance paying for health care. Medicaid provides coverage to families, children, the elderly, pregnant women, and people with disabilities. What types of Medicaid are available to adults with disabilities? There's aid to the permanently and totally disabled, or APTD. There's old age assistance, or OAA. Aid to the needy blind, or A&B. In and out Medicaid, which is also known as Medicaid with a spend down. Medicaid for employed adults with disabilities, or MEAD. Temporary assistance to needy families and financial assistance to needy families. And then there are special categories of coverage under the Home and Community-Based Care Waivers, or HCBIC, and under 1619B Medicaid protection. What is APTD Medicaid? APTD provides Medicaid coverage to individuals with disabilities who qualify. It also provides cash assistance to certain low-income individuals who qualify. If you qualify for cash assistance, you automatically qualify through Medicaid through APTD. For more information, see the slide presentation on New Hampshire benefit programs for individuals and families. Who is eligible for APTD Medicaid? The requirements for eligibility: you must be between 18 and 64 years old. You must have a medical condition expected to last at least 4 years or result in death. You must not be earning over substantial gainful activity, also known as SGA, or $1,070 gross per month in 2014 at the time of application, and you must have resources below $2,500. What is A&B? Who is eligible? A&B is a Medicaid program for people who are visually impaired. The same eligibility guidelines as APTD Medicaid apply, with the following exceptions. You must be legally blind, and you can be any age. What is old age assistance? Who is eligible? Old age assistance is a Medicaid program for people who are over the age of 65 and are low income. The same guidelines as APTD Medicaid apply, with the following exceptions. You must be over the age of 65, and you do not need to have a disability. What is in and out Medicaid? This program provides coverage to individuals who do not meet the income limits for cash assistance for APTD or A&B Medicaid. Other requirements do still apply. In and out refers to the fact that an individual must re-qualify for Medicaid each month on this program. A spend down amount is determined for each individual on this program. Who is eligible for in and out Medicaid? Individuals who do not meet the income limit for cash assistance for APTD or A&B Medicaid. That means that their income has to be over the protected income limit of $591 for a single person or $675 for a couple. And they must meet the $2,500 for a single person or $4,000 for a couple resource limit. They must be otherwise eligible for Medicaid. What is a spend down? A spend down is how much has to be received in unpaid medical expenses before Medicaid will begin coverage for that month. For example, a $100 spend down means that the individual must have acquired $100 in unpaid medical expenses before Medicaid will begin coverage for the month. Even if $100 is not reached until the last day of the month, that is the soonest that Medicaid will begin. What about Medicaid for people who are on TANF or FANF? Medicaid provides coverage for low-income adults and families with dependent children. The TANF or FANF Medicaid eligibility groups include the New Hampshire Employment Program, the Family Assistance Program, Unemployed Parent Program, families with older children, or interim disabled parent. A person can have a spend down with TANF or FANF Medicaid if they do not qualify for cash assistance and are over the income limits. What is Medicaid for employed adults with disabilities, or MEAD? It provides coverage to individuals with disabilities who have employment. Individuals on MEAD can have higher incomes and resources and still receive Medicaid coverage. Depending on your income level, you might have a premium. Who is eligible for MEAD? You must be between the ages of 18 and 64 years old, employed or self-employed for paying FICA and related taxes. You must meet the medical eligibility for Medicaid in New Hampshire, and you must meet the monthly income limit of up to $4,309 or $5,816 for a couple, and you must have the resources below $26,754 for an individual or $40,131 for a couple. What are the Mead income and resource limits? Here's a table that shows the resource and income limits for Mead. And here's a table that shows the Mead premiums. As you can see, an individual making $1,436 net or less per month does not have a premium. Can you explain the home and community-based care waivers? Once you qualify for medical assistance through Medicaid, an individual can qualify for a Medicaid waiver under the home and community-based care waivers, also known as HCBIC. There's HCBIC Choices for Independence, or CFI, HCBIC Developmentally Disabled, or DD, and HCBIC Acquired Brain Disorder, or ABD. These HCBIC Medicaid waivers provide additional coverage and services for these specific populations. What if I am an SSI beneficiary? What happens to my Medicaid if I am working and I earn enough money that I no longer receive an SSI benefit? You could be eligible for 1619B Medicaid. 1619B is Medicaid protection for SSI recipients who earn enough to zero their SSI cash payment. With 1619B Medicaid, when an individual's SSI cash payment stops, their Medicaid coverage will continue. 1619B keeps individuals linked to SSI. If earnings drop low enough, SSI cash benefits will begin again with no need to reapply. This protection can be accessed through any Medicaid program as long as the requirements are followed. What do I have to do to be eligible for 1619B Medicaid? You must continue to meet resource limits to qualify for Medicaid coverage and an SSI cash benefit, which means you must have resources below $2,000. Your earnings must be below the threshold amount, which in 2014 is $38,505. You must have been eligible for an SSI cash payment for at least 1 month. You must still meet the disability requirement. You must still meet all other non-disability SSI requirements, and you must need benefits through Medicaid in order to continue to work. You must also be able to answer yes to the following questions. Have you used Medicaid within the last 12 months? Or do you expect to use Medicaid within the next 12 months? Or would you be unable to pay unexpected medical bills in the next 12 months without Medicaid coverage? Want more information? You can view the rest of the videos to learn more. You can contact Granite State Independent Living for assistance. You can visit the New Hampshire Work Incentive Resource Center for more resources. You can contact Social Security Administration or New Hampshire's Department of Health and Human Services for more details. If you are connected with an area agency, a mental health center, or vocational rehabilitation, you can contact them for more information and assistance.